consideration. There was quite a bit of work that was done. I met with multiple organizations, the hospitals, the county, several other individuals in the healthcare field, to get some ideas on how we needed to proceed with the promulgation of our rules and procedures that we're going to need to follow going forward. I would suggest that maybe we go through the document. Well, first, let me say that there are three different ways I think we can go. I offer to be the point person for trying to spearhead this, so we all would be going in different directions and duplicating effort. It's been suggested that we hire our own staff, have an executive director and one or more employees to implement the requirements of the new legislation. It's been suggested that we come up with our own policies and procedures and maybe go through a request for proposal process and come up with an outside agency to do the work for us. And it was also brought to my attention that there was an existing tax district in Volusia County, the West Volusia Hospital Authority, that was already operating under similar but not the same documentation requirements. And so I contacted them as well, and I would like to start, if I could. I want to be able to discuss all three of those options tonight if we can, but I would like to start with a presentation by two gentlemen that came here from Driggers, Rigby, and Teal, accounting firm over in DeLand. They performed some administrative work for that West Volusia Hospital Authority, and I'd like for them to come up and just give a brief overview of how their system works. If they don't, I can, and maybe the hospital representatives can indicate how it maybe differs from what we're trying to implement, but there are some similarities that I think need to be brought to the attention of the board. So with that, Mr. Al Powers is here, and Ron Cantlay as well, but I think Al is going to be giving the presentation.
I'm Al Powers with Driggers, Rigby, and Teal, and it's my colleague Ron Cantlay. And we first learned about the way that this hospital district was moving probably back in October and November, and it looked like it was moving to a similar model as what we have with the West Volusia Hospital Authority. And then I used to work with Green and Courage Rice Brown, and happened to see Pat several weeks ago and inquired about progress with the North Lake County Hospital District. We took over providing services for the West Volusia Hospital Authority in October 2007. And at that time, they did have a staff. They had an employee and a half. They had an office that was staffed 60 hours per week. There was a person with the title of executive director. And then there was a part-time employee. And they were subject to required retirement because they were they were government employees. Well, the executive director answered the telephone and did the minutes, but the nuts and bolts of running the authority were done by professional CPAs and attorneys. So when we took over, and we have an accounting contract and an administrative contract, our first recommendation: get rid of employees. We can do it all. And we have since then, and we have created a model where the dollars actually follow the patient. We provide more services than I think that you're endeavoring to do. But to Florida Hospital was a better way to go. But at one time, and we also, we have a primary care network, 3 clinics, idea of keeping health card users out of an ER. We also have a specialty care network. When we took over the Volusia County Health Department, and I've got some handouts on the top of the previous procedures and current procedures, but the Volusia County Health Department was doing eligibility, and we wrote some eligibility guidelines in 2009, which are provided in your packet. We went to, and the Volusia County Health Department issued a health card back then. They weren't good at keeping data. Now we have a system. We moved to a third-party administrator about 3 or 4 years ago, and they issue the health cards, which are good for 6 months. They make the patients or users apply for Medicaid at the same time, and they've made a lot of Medicaid recoveries for us to pay for themselves. At one time, when it was under the health department, primary care was costing about $150 per encounter. Now it's down to $107 per encounter. And like I said, we provide services that you don't intend to provide. We have pharmacy services. We have a specialty care network. We fund the hospital to the tune of about $5 million per year. That's a contractual arrangement. When the hospital was sold, it's adjusted every year by the increase in the CPI index. But with us, our district, we have found that the TPA provides some good information to us about how much each individual, and there's one of their reports is in here. It's Exhibit C, which is provided at each monthly meeting, and it has all kinds of demographic information in there, what services are provided, what each patient is costing. We have approximately, and it goes up and down because people are constantly moving in and out of the system. They become eligible or they lose eligibility, but we have about anywhere from 1,800 to 2,000 health card users. And we fund about $16 million. That's what we raised in ad valorem. We do the accounting and the administration. We work closely with the third-party administrator, and we advocate that system. They have saved our district a lot of funds. So we're happy to answer questions or.
Al, can you touch on our legislation requires us to perform or to audit any provider that receives more than 10% of the tax proceeds in any given year, and I'm assuming that means the residency requirement, the assets and the income level, that type of thing, medical necessity. Who does that? Are there similar requirements in your tax district, and if so, who does that?
Our third-party administrator, they review the eligibility, and they approve the application for there's actual fiscal health card. So where that information is gathered, that is presented to TPA, third-party administrator, that information is gathered at the primary care clinic. And it is sent electronically to the TPA, and they do residency, the income, they do all the eligibility, all the background testing.
qualification and some of those do in fact qualify for Medicaid?
Some of them qualify, or some of them do become eligible, and what has happened is that when they subsequently find out that they become eligible for Medicaid, the hospital, you know, build Medicaid for that service that was really initially going to be paid for by the hospital authority.
Okay.
And they made a lot of Medicaid recovery for us.
What was the budgeted cost for the TPA service for this fiscal year?
For eligibility, it was $110,000, and it looks like they will meet that. We had a spike in applications in March, and then for processing claims. Now, I do not think that with the system that you're envisioning, just primarily the hospitals, maybe 5% primary care and 5% mental health services, you wouldn't have near you know, bureaucracy or the number of organizations, because we have a specialty care network with providers, and they process all those claims. But that budget for processing all those claims, that amount is $605,000.
Okay. And it's on a per claim basis?
And there's some escalators in there, you know, if it's reduced, if it goes over a certain amount, or we could provide you that information.
And do your hospitals, our legislation also specifically allows the acute care hospitals to participate in Medicaid matching programs, and I think there is a desire that we at least, you know, look at that opportunity for our hospitals as well. Do your hospitals participate in that?
They do participate. They've participated for the last 2 years and are going to participate again. And the way that works in our model, our system, we advance those funds to ACA. Payments are made quarterly, beginning in October, and then claims are processed against those advances. So it would be possible, I suppose, I mean, at the end of the year, if there weren't enough claims to exceed that advance, the hospital would owe money back to the authority, but that has never happened.
Okay. And we had similar language in our legislation, I believe. I've nominated here, so if anybody else on the board wants to ask questions, please feel free to do so.
Could I please ask, who is Northeast Florida Health Services? Was that one of the?
Oh, that's the primary care clinic. They provide.
Oh.
They operate 3 clinics.
Okay, so and you referred to a third-party administrator. Who is that?
They are an organization. Their name is HS1. They are in South Florida, and all this is done electronically. They do attend our board meetings as requested periodically, and they are the ones. In addition to the clinics, we also have a specialty network where our health card users can receive, you know, a whole list of eligible services, cardiology, oncology, and they contract with the providers for specialty care services and oversee that and process claims. But I don't think you envision going there.
Well, we try to, but the hospitals didn't like that plan, so Representative Metz had to change our plan to what we have, the legislation to what we have now. And I understand now, you've got a very ambitious program. I mean, really. And your millage rate, I noticed, is 3.3015.
No, we're not that.
I looked it up today on the property appraiser's website.
It was 2.3849 last year. We're not that high yet.
Well, you'll have to check with Galbraith and see what he says about that then. I lost my train of thought now.
We've actually we've been at rollback the past few years. 1 year recently we went 2% below, but services. Because the cost is going up so much.
Well, I have heard from, I have friends in Volusia County,
Mm-hmm.
and I have heard from them that they feel that businesses will not come to Volusia County because of the high tax rates in the hospital district. You know, of course, we have never owned a hospital, so
Mm-hmm.
we were not glad to get rid of one, like, I guess you've got two that you got rid of, right?
I don't believe that Fish was even built yet, but it was,
okay.
yes, West Solution eventually, Fish down in Orange City was built.
Well, one of the goals in our new charter legislation is to reduce the millage rate.
And that all depends on what type of services.
Of course, now you service 150% of property.
Right.
Well, see, our legislation says 200%.
Right, right. So it would be more people, yeah.
Mm-hmm.
It would be more people. But we have found that with an outside source doing the qualifying, even though they are included in the budget, I think that they have definitely paid for themselves, that CBA. We started seeing some costs go down once they became involved, and like I said, we have information now, which we didn't have before, helps us because they are like a gatekeeper, you know, and so there's a series of checks and balances, and they've done a good job for us.
Thank you.
Have you ever heard of TK being incentive-based?
Incentive-based?
Yeah. Homeowners, they've heard.
No.
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 Can work.